Welcome, everyone. Hi, my name is Isra Shakir, and I am a board of directors member for Med Global. Thank you for tuning in today. We are so excited to be here with you all. For those that are practicing in Ramadan Mubarak to you. This is a very special night. It is the 27th night. It is an odd night, and is also a Friday. So we know that this is a very special night for our community and in our faith. And we're excited to be here with you all to share more about Med Global and the work that we are doing in Gaza in particular, something that many people have been interested in. I've been as part of Med Global in a few different capacities for over 5 years, and I am a big advocate and fan of the work that they are doing. They send medical missions across the world to areas where many organizations do not want to go and cannot enter. And Med Global is there providing top grade medical health care and services to those in need. And right now, we've seen this play out over the past 6 months and even before that in Gaza, and in particular during this intense crisis of how Med Global has shown up for the people of Gaza and serving in hospitals and in clinics, saving lives every single day. So they have had multiple medical missions, which we'll hear more about today. The experiences on the ground from some of the doctors who've went and attended and participated in these medical missions. And more than anything, you'll find ways to give today to Med Global. So as you'll see on the screen, you'll have if you just text Gaza to 801-801, you can donate very easily. I want to keep re-emphasizing today of the importance of this Friday, of this 27th night, and any dollar that you give will make a difference, will go directly to supporting our programs in Gaza. There is nothing that is more impactful right now than that. And we are providing services across the board, which we will share more with you tonight. So first, I would like to start off with a video from Dr. Thair Ahmed, a board member of Med Global, who is not able to join us tonight due to being on a flight, but has sent a video with his remarks to show you all and hear from him directly about why he is involved with Med Global.
Assalamu alaikum, everybody. Alhamdulillah wa salatu wa salamu ala rasulillah. Thank you for joining us this evening. I wanted to just share a few thoughts with everybody, given the scale of humanitarian crisis that's taking place in Gaza and how we may be able to contribute in our own ways and how we can hopefully be a part of the solution. There's a couple of things that I think I'd want to start with. We understand that in the north, the situation is dire and that people are struggling with food insecurity, malnutrition, famine. This has resulted in the tragic loss of 23 children starving to death. And so the question remains, how do you address this massive problem? What do you do? It's important for everybody to understand you're not going to just be able to feed children right away who are starving. We've let it get to a point that they need medical supervision. They need to be admitted to a hospital, to a clinic, where they can slowly build the strength back up to be able to have food again. Now that's something that Med Global is doing. They're thinking about establishing and seeing patients for a nutritional stabilization center in the north, in the area that is affected the most by this. And they're replicating what they've done in the south. There is already a nutritional stabilization center that is seeing children every single day, that is helping prevent the sort of tragedy that we've seen in the north. And so this Ramadan, I would ask that all of you in these closing days, there's only a few blessed days left, think about how you can contribute to that. Make the intention right now, as you're watching this, make the intention that you want to contribute to alleviate the suffering. And maybe it's by donating to the Nutritional Stabilization Center, or maybe it's other programs. There is maternal health programs that you can easily contribute to that will make an impact. And also sharing this information with other people, letting them know that when it comes to malnutrition, and it comes to starvation, it's a lot deeper than just airdropping food. It's more complicated than that, and it's going to require all of us trying to contribute together and figuring out a solution for this. I think that there are a lot of things going wrong in Gaza right now. But let's be one of the things that's going right. Let's try to be a part of efforts that can not only ease the suffering, but bring awareness and attention to this. So let people know that these are the facts that are on the ground. This is what the North is facing. Here's the problem in the South. We know that Al-Nasser Hospital and Shifa Hospital are out of commission. Those are the two largest hospitals in the Gaza Strip, no longer functioning. So Med Global tries to make up for that gap by creating medical points. And these medical points are actually within the displacement camps. You hire Palestinian doctors and nurses to treat patients. Got over 100 of these healthcare workers that are contributing to this and have over 10 medical points. So all of this is to say that there is a lot of pain and all of us are feeling what's going on in Gaza. But it's important to be active, to do something about it, to step up when your name is called. And I know that many of us will answer this call. And again, I remind everybody, let's take advantage of these last couple of days. You're in the position that you're in for a reason, and I'm in the position that I'm in for a reason. Let's not forget all of the blessings and the opportunities that we have, and let's take a chance to do some good, to gain some hasanat for all of this, and contribute, and hopefully we make an impact, and we can say that we did something when a lot of people turned away.
Those are powerful words from Dr. Thaid Ahmed, who is a board member as well. He has been to Gaza with Med Global more than once, and he recently returned and shared his experience with the President of the United States and other high-ranking officials in the administration. Next, I would like to just remind you, again, if you want to give, to text Gaza to 801-801. It is so easy to give today. You can do it on your phone. You can do it as you're watching this. You can screenshot and then do it after this. But please give generously to support the programs that Dr. Thaid was describing. As a reminder, I want to also share some price points with you all because it's easier to understand what you're donating to when it's tangible and when it makes sense. So for $250, you can provide medication for 50 patients, 50. For $250, you can provide medication for 50 patients. That is such an easy lift for so many of us when we don't think about how much we spend $250 on, and to know that you can support 50 people with their medications is amazing. $150 gives medical supplies for 50 patients. So everything to treat and direct medical supplies, only $150. $85 a month would improve the hygiene standards for IDPs in a household, which means internally displaced peoples in a household. $85 a month. Think about what you spend $85 a month on. And instead of giving it to your coffee or whatever it may be that are all extra privilege and access that we have, give it to an IDP family in Gaza. $100 funds critical care medications for 5 patients. So critical care, which we'll hear more about shortly. And then $250 funds vascular support medications for 5 patients. So many more things coming with you today to hear more. I'm excited to introduce next up Dr. John Kaler, co-founder of Med Global, as well as a board member. Dr. John, welcome to the live stream.
Thank you so much. I appreciate the opportunity. It's a blessing to be able to participate in this. I hope everyone who is celebrating has had a blessed Ramadan, and I hope that this last Friday night is beneficial to you both spiritually, and I hope you're able to participate in helping Med Global, helping fund Med Global's activities in Gaza, since I know it's very, very important. It's number one on everybody's prayer list.
Exactly.
Let me just say that I've been able to go. I've been in Gaza several times, but I have been able to go twice since October 7th. First, in January, I was in a team of leadership that went in to decide both to give remember, we've had a team in Gaza since 2019, and they had been literally on the wall since October 7th. They were among the last to be, the last to leave Shifa Hospital. They walked south like everyone else did, like the 900,000 people that left during the months of November, December. But they didn't just shelter when they got south. What they immediately did was go to work. And because of their hard work and dedication, they got us they got us embedded in the United Nations process. We joined all of the health clusters. And the other thing they did was they began the process, along with our colleagues in UNICEF and the World Health Organization, to set up a primary health center. That was what we went in January to do. And we did that. We opened two activities. First, a primary health center, which was seeing in the first week that we were open, we're seeing between 600 and 700 patients a day. But in addition to that, we set up medical access points, which are essentially small clinics, in 9 shelters around the Rafah area. Now remember, Rafah went from a concentration in October before this crisis. There was about 7,000 to 8,000 people per square mile. In January, we went in, there was 50,000 people per square mile. So think about that. And there was no facilities. This is in 3 months. It went from 7,000 to 50,000 people per square mile. And for those of you who need a little bit of orientation, the size of Rafah, you can fit Rafah inside the perimeter of the Istanbul airport. That's the size of what you're talking about. The perimeter is actually bigger than Rafah itself. When we went in and we opened up the medical access points, so they sound like clinics and they are the delivery of medication, but they're at things like schools. So think of your local primary school, and then think of putting 4,000 to 6,000 people in that building with as many bathrooms as in a building like that. So the estimate you'll hear is that there's 1 bathroom per anywhere between 200 and 400 people. That's on the good side. All of the tent cities that were, they're not really tent cities. All of the complexes with tents, and I use that word quite loosely because they're really not tents. They are shelters that have tarps laid out over them. All of those had no bathroom facilities because those were just set up wherever they could set up. And so then they had to set up porta potties and things like that, which might not sound all that bad, except for one thing. There was no sanitation. There's no water, there's no cleanliness, there's no heat, there's nothing. 900,000 people moved down into a city that was founded in about 1420. So, I mean, it's an old city that was just literally overwhelmed within a couple of months. But anyway, so our team was able to set up the clinic, set it up, got us up and running immediately, along with the medical access points. And we went in to see the types of things that were necessary. Dr. Taher, Nareen Ahmed, Chandra Hassan, and Dr. Salul all were able to go to Nasser Hospital to begin working on the urgent patients that they saw there. Being a pediatrician, I worked in the clinic and at the medical access points and began to set up the process of nutrition screening. Now, everyone knew, this was in January, everyone knew there was going to be problems. Everyone predicted because the occupying forces said that they were cutting off food and every other activity of daily living. This wasn't subtle. They said this is what they were going to do. And everyone knew if this didn't change, everybody, you can tolerate, before this crisis, these kids were getting about 80% of their calorie needs. So they were undernourished even before the crisis. But you can go a long time without food. Now, by that long time, we're talking 3 to 4 months. Now, we're already at the 3 months. Now we're at the 6 months. And now you're beginning to see the tipping point. Mm-hmm. Now these children that have been deprived of food, the pregnant women at the time in October, they were estimated to be 30 to 50,000 women who were pregnant. Now, unlike diabetes and hypertension, every one of those were going to go forward. So we were beginning to see by January, now this was now 2.5, 3 months in there, we were beginning to see deliveries that were happening in the most unsanitary conditions. C-sections were happening in makeshift clinics. A lot of these things were happening without anesthesia. So we had reached a point where everyone could see that if things didn't change pretty quickly, we would go over the edge. That's in the south. No one knew what was going on in the north because Wadi Gaza was the cutoff point, and no one was permitted north. So everyone anticipated, because when they moved from north to south, they anticipated that there was going to be problems. Well, it wasn't like everyone left. There are still 300 to 500,000 people in the north,
Right.
and they literally have nothing.
Right.
So this is what was set up in January, and then Dr. Taher, he's not going to be on, unfortunately. I think Dr. Hassan might be on the call somewhere along the line. I know Dr. Salou, when he comes on, we'll talk about the things they saw in the hospital. You've all seen them. It's as dramatic as it's 10 times worse than whatever you've seen on TV. There's just no
Wow.
questions about this.
Wow.
So what happened then when I went back in March was every square meter that had been even opened at that time was now occupied by a tent or some version of that. When I went back in March, then with UNICEF, with the World Health Organization, I was the first of the pediatric staff that was able to go north. And I was able to go to Kamal Adwan Hospital and meet Dr. Hussam, by the way, who is a real pediatric hero. Dr. Hussam al-Safiya. He was during the initial assault, he single-handedly kept the Department of Pediatrics going. And if you'd like, he's still there working. He's on the wall still. Any donation you make to Gaza right now, you can donate it in his name. It's Dr. Hussam al-Safiya. Any amount of money you donate will be useful. When I went there in March, I went in two armored vehicles, and I'm sure we will address this whole concept of armored vehicles and how safe they are or aren't, thanks to because of the World Central Kitchen issue. But when I went there in March, we brought along 6 cases of special formula. 6 cases now. And there were 12 cans in each case, so 72 cans of special formula, and you would have thought we brought manna from heaven. This is how thankful they were. They're already seeing, at that point in time when I saw the hospital itself, the hospital maybe 40 beds, there were 65 occupied. Every single one of those children was dehydrated, and the vast majority of them were significantly malnourished at that time also. To the point once, and I won't show pictures, but to the point once there was a 8-year-old, actually an older child, 8-year-old that looked like the type of child you see curled up, having had cerebral palsy or something, and malnourished. And they said this child had been well before that. Now, I didn't believe it, truth be known. When I was talking, I thought this is an exaggeration. Well, the mother pulled out her phone and showed me pictures of the child, showed me pictures from 2 years ago, and here's this smiling, well-developed baby, and then showed me pictures from 1 year ago. Here's this kid, robust, playing soccer, and then what I saw in the bed was just heart-wrenching. And again, any donations that you make to Kamal Adwan Hospital, to Dr. Hussam, will go directly to service these type of things. This is the hospital at which we're going to be setting up a nutrition access point, nutrition resuscitation point. If the simple issue here really is that if the access is open, we can solve this nutrition problem in 3 months. The food is there. When I was in Rafah, I could throw a rock across the border and hit the food. All right. It exists, and it exists on the border. And I understand that the Israelis said that they were going to open up more opportunities to come in, including Eretz. Eretz is the north entrance. If they really do open Eretz, and this, by the way, that's a huge if. We've heard a lot of this for a long period of time, the same way here. So be thankful on this Ramadan that the word is that they're going to, but also be cautious and be observant to see if that really does happen. So a lot more we can talk about. I'm sure we'll get to it in Q&A, but that's a quick summary of what the difference between the South and the North, and the difference between January and March. I'd only mention one thing, which was when you had to stop at Wadi Gaza. There was checkpoints and things like that. Wadi Gaza is the separation from Gaza government to the south. I happened to stop at World Central Kitchen. That's where it is.
Wow.
And so it was frightening to see the pictures of the vehicles that were attacked right out in front of the spot where I'd sat at. And there was all this, our trips, everywhere we were, they were deconflicted also. And the deconfliction is supposed to produce safety. Obviously it doesn't. Obviously it doesn't. And those were seven deaths, but those were only 7 deaths among 40,000 deaths. So yes, it was terrible, but death has been there since then, and it's going to continue along unless we get an immediate ceasefire.
Yeah, thank you, Dr. John,
Sure.
for sharing your perspective. And there's a ton of questions I'm sure people are having. Please feel free to drop your questions in the comment section of where you're watching this, whether that's on Instagram or on Facebook, and we will get to questions towards the end. Dr. John, I just wanted to uplift a note you mentioned before we bring in Dr. Zahid, and then we'll do a Q&A with both of you at the end. One, you said that we were opening up a nutrition site. Could you specifically talk about how MedGlobal is unique in responding to the malnutrition that we're seeing?
Yeah, I certainly will. We were one of the first 3 international NGOs that were able to go in as an international team. Our Raja Musleh, who is our country director, has a very good relationship with both the health cluster and the nutritional cluster of the United Nations. We were able with that to get a grant from UNICEF that would permit us to do screenings. And those screenings, by the way, when you hear all this stuff about the percentage of children that are malnourished and stuff like that, those screenings are only on children from 5 months to 5 years. So every statistic you hear around that is on that population. So it misses the population of kids that are, 0 to 5 months. It misses the most important one to me as a pediatrician. It misses the whole issue of pregnant women. All of this is missed in these screening numbers. So we were able to set up a relationship with UNICEF, and we were able to do this screening. And with them, then UNICEF and the World Health Organization is able to supply. They did get supplies, so it's like nothing going on. They were able to get two types of things. One is a special formula. This is a hyper concentrated formula with extra minerals. And then the second one is stuff called ready to use therapeutic food, which is supplemental food. Most people on this call have heard of something called plumpy nut, which is a peanut butter like packet with over 500 calories in it. So it's a fantastic thing. And we were able to set that up at the screening centers, these peripheral things I mentioned to you. We did what was called a spoke and a hub process. The hub was where you sent children that needed special care. And so to do that, we built out what was called a resuscitation center, which we had 6 inpatient beds. So some kids needed not just extra calories, which all the kids needed. By the way, this is not, it's nice to screen because you need numbers, but 100% of children are suffering, okay? And the first thing that happens when children suffer is, as anybody else, the first affect of pain, or the effect of pain, of hunger is pain. Remember that. Anybody's been hungry. You all have been suffering. You all have been hungry now for 27 days. This is the 27th day. So you know what it's like. And so think about a 6-month-old like that. And think about no iftar. They don't break their fast. They get what they can get. And the adults, God bless them, the adults suffer even more because they sacrifice what little they have to get to their kids. All right, so the resuscitation center then is where kids are sent who have some special needs, and sometimes they need intravenous fluids to get rehydrated more slowly. They need special formulas to be delivered by the fluids. They need to be observed. The other thing is, on top of all of this, I haven't mentioned it once because it's so obvious, but let me just mention, all of these families are also suffering from the mental effects, the psycho-emotional effects that happen from bombing and war. So if you take a kid who is hurting and a family that is suffering, that's a setup for feeding problems in addition to nutritional problems. So there will be a subset of children and mothers need to stay with the care of loving adults. And that's basically, or that's part of what we do at the Nutrition Center. So that's what's called the Nutrition Stabilization Center. It's a referral center both from the Ministry of Health, from other resources, and from our own nutrition, from our own places, our own clinics. That's in the South. In the North, it's going to be different, but in the North, it'll be more intense.
Yeah, of course.
But that's the South.
John, how many patients or how many kids will you expect to see at this place? And what does it cost to support something tangible for people to understand the cost of support? Any numbers that you could share?
So the answer to your first question, which is numbers, the numbers will be artificially low, simply because the other thing that happens in the South, and it's worse than the North, we haven't set up here yet, but the other thing that happens in the South is that I'm telling you, we do a hub and a spoke, right? Mm-hmm. Well, at the end of those spokes, it isn't like in the States where you just say your baby needs X and I'll happen on Uber to go to the center. It's very difficult to get from one place to the other for two reasons. One is it's very congested, but the other thing is it's very dangerous. Mm. There is for the international workers, there's a soft curfew at 6 o'clock and there's a hard curfew at 8, which means it's dangerous to be on those roads. This deconfliction thing you hear about doesn't apply to the citizens. Wow. That's why people are killed this way. It doesn't apply to citizens. So it's hard for people to get back and forth. As far as the number is concerned, $35 per child will supply enough special formula to keep that child going for a week.
Wow, that's it? $35?
Oh, that's that. I mean, it's just these. Wow. This is the special formulas are supplied to us. So we're talking basically salaries of staff, Palestinian staff, by the way, that most of which have been displaced. Mm-hmm. Which is the other thing that's forgotten a lot is that these are professional folks that have been driven south. I'm tearing up right now because the head of our nutrition center in Rafah is Dr. Youssef. Mm. Dr. Youssef is a 25-year experienced pediatrician who worked at Kamal Adwan Hospital. Because of the bombing, he was forced to walk, and it's probably 10 kilometers, 12 kilometers maybe, walk south. Wow. When he got to Wadi Gaza, it was so congested that he lost his family. So he got separated from his family. So he got across, and those were the days when, remember, so at first all the men were suspected, were suspects. So think about a mass migration of 900,000 people over the course of a couple of months, walking south, crossing borders where every man from 18 to 35 is suspected. And so they're pulled out and interrogated. Mm. Well, during that interrogation is when his wife and 3 children got separated from them, and they were separated for 2 days. And it just, when he was telling me the story, now he's telling me the story while he's working. He's not getting paid a penny. Mm. They used to get paid when they were working for the Ministry of Health. They would get something like 60% of whatever their agreed salary was. That was on October 6th. From October 7th, they never got a penny. We're employing them now. So we're employing these folks that work these places. In the spirit of Ramadan, let me tell you a story that was told to me. There was a doctor, excuse me, there was a doctor at the doctor at Al Nasser Hospital, who said that one of the things this crisis has shown him was what a blessed life he had. Mm. And I'm looking like, how is that? And he said, well, let me tell it to you this way. He said, before the crisis, I was only getting 60% of what I thought I was supposed to be making. Since the crisis, I've gotten 0. Before the crisis, we were getting maybe 70% of the calories we needed during the day. After the crisis, we're getting 20. Before the crisis, if I didn't have enough heat in my house, I complained at the price of gasoline, price of propane to reheat my house. Since the crisis, I live in a tent, and we heat it with small, what do you call it, small fires. He said, so it really tells me that my life has been blessed. My life had been blessed. It was a matter of miracles. And that just, I mean, the concept of that level of understanding about life, that existential awareness was just beyond me. It's hard to put these things in words because I'm not strong enough to have ever survived anything like that. These people are this population is the most resilient, strong population I've ever seen. And any donation that can be made to this simple Gaza number down there, please do it. We'll go to support folks that need literally everything. Literally everything.
Thanks, Dr. John. That was so powerful and so incredible for you to share all of that with us. And we're going to come back to you in a little bit with a question. So thank you, and stay tuned for people to ask more questions. Dr. John, we did get one question in which I have the answer for. It's, can us nurses volunteer in Gaza? Yes, we're still welcoming volunteers from various medical fields: OB-GYN, orthopedic surgery, trauma surgery, vascular, plastic and reconstructive surgery, pulmonary and critical care, anesthesiology, emergency medicine, pediatrics, and nursing, OR, ER, labor delivery, midwives. And so if you want to volunteer, go on medglobal.org to submit a volunteer form. And due to the overwhelming response, because we've had a lot of people show interest and commitment to try and go into Gaza and help, we're not able to reply individually to all applications, but rest assured, every application is very important to us and is being carefully reviewed. So
let me add something to that, Isra. Thank you very much. You rattled those numbers off and those subspecialties. God forbid you know them, right? Thank you. But let me mention this. We've had an overwhelming response. The people of all walks of life want to go. It really is a situation right now where we can't be taking a lot of different types of people. Not because we don't want to, but because we usually respond to what the World Health Organization emergency medical teams ask us for. And that changes periodically. And so all people like myself who are primary care docs really are lined up ready to go. But if you remember what I just said, we've had a whole country worth of primary care docs driven down into a very small area. So we have access to a lot of very, very good physicians.
Amazing.
Once, whatever the day after is, inshallah, whatever the day after is, we'll be able to put together during whatever and however reconstruction happens, a much more robust response from the States. I'm sure everyone will want to stay on it. And it's very important to remember this, because I had a discussion with a colleague from the BBC. There's going to be the bombing will stop, God willing, sooner rather than later. The bombing will stop. Entrance will be opened up to some extent, and some rebuilding will start. At that moment in time, all the cameras will be gone. Okay, they'll all be gone. And so that's when, remember to keep reapplying to us. This is a generational trauma. It will last. I'm an old man. I won't see any of the end of this. That's why this torch needs to be passed to all of you who are listening right now. Not now, but when the bombing stops and the real reconstruction happens is when we'll need you, because I can rebuild the hospital in a month if you give me the right stuff. We'll cure this famine thing in 3 months if we get food in. Okay, the food's there. What's being attacked that's going to take a generation is agency, integrity, and dignity. Absolutely. That's what we have to work on. The bombing stops today. There's still no schools to go back to.
Absolutely.
The buildings are blowing up. The professors have been killed. The students have been spent. So it's not going to happen. So once that stops is when we have to begin to think of creative ways to help these communities. One thing you can do now is donate money to help us now. We do need it. We need acute things right now, but
Mhm.
don't forget us when the cameras go away. There's going
Definitely.
to be another crisis. God knows there's going to be somewhere in the world, and the BBC and CNN will also be there. We'll still be in Gaza.
Yep.
We'll still be there. We were there. We're there now, and we'll still be there. So
Thank you.
any help you can give us is please do.
You're amazing, Dr. John. We'll come back to you. I next up, I want to welcome Dr. Zahir Sahlul, the
Oh,
president of Med Global, to the stage, the virtual stage. And as a reminder, we want you to donate. Today's the 27th night. It is before iftar time here to break our fast, and this in the DC area. And it's coming up soon in Chicago, wherever you're watching. This is an important night, and you're hearing directly from doctors who have gone on the ground and seen with their own two eyes, their own two ears, what's happening in Gaza. Welcome, Dr. Zahid. You heard Dr. John give his insights and reflections, which were so powerful on what he witnessed in his two trips so far in January and March. What would you like to share about your experience, and maybe from a different perspective than the pediatrics and the nutrition side?
Well, thank you very much for having me. And John, I think he said enough. I don't know what I can add. Maybe certain perspective about famine, because I was reviewing when was the last time the world declared a famine, real famine, and it was in Somalia. And I think some people may remember that. And at that time, 250,000 people died because of famine, 250,000. So in order for a famine, which is now they call it as a looming famine in Gaza to happen, you have to have three criteria. I think John has mentioned them, but one of them would be that most families, or 20% of families, will have the highest level of food insecurity. The expert classify food insecurity. I mean the inability to reach or enough food or nutritious food to five level. The fifth level is the most worst or most severe, catastrophic. So 20% should have that. In Gaza, 50% of the population have catastrophic food insecurity. That means 1.1 million people have the highest level of food insecurity. We're talking about adults, children, women, elderly. The second criteria is to have 1/3 of children with acute malnutrition. We already exceeded that, especially in the north. And the third criteria is when you have basically people dying because of malnutrition. By the way, people do not die because of malnutrition itself. They die because of infections related to the poor immunity, related to poor nutrition, as John is the expert on this. So when you have 2 out of 10,000 people dying every day, then that's declared then, if you have these three criteria, as a famine, which means about 200 people in Gaza will be dying every day. Not from bombs, not from missiles. These are people who are dying from infections related to malnutrition. Yesterday, Oxfam, I think you worked in Oxfam before, Isra, released a report about the average adult in northern Gaza, how much calories they are getting. And guess how much calories the adult in Gaza, northern Gaza, is getting on a daily basis. But by the way, the average adults in the world gets about 2,000, 2,100 calories every day. You have a wild guess?
I read the report, so I'm not going to say it,
Okay.
but it's a lot less than that.
Yeah, it's 10% of that,
Wow.
245 calories,
Unbelievable.
which is a can of beans. So that gives you an idea about the access to food. Despite all of this rhetoric about increasing food aid and airdrops and all of these things, people do not have access to good food, nutritious food, and that's why they're eating animal feed. Actually, I felt sorry for humans, of course, we should, because they're suffering, but also for the animals, because they don't have also food. I mean, donkeys are one of the main modes of transportations in Gaza before the crisis, but now it's becoming even better way of transportation because they're cheaper compared to the cars because of the shortage of fuel. So for people who are familiar with Gaza, it's $1 to ride on a donkey carriage from place to place, compared to like $10 or so to if you find a car. So most people cannot afford to have a car or taxi. And you can say, okay, taxis are working or cars are working. Yes, and they use cooking oil because there's shortage of diesel fuel. So they use cooking oils, and sometimes they have these innovations where they have the cooking gas connected to the car somehow, and it operates it. So people are really creative in Gaza, very creative. But donkeys are emaciated because they don't have access to food. Also, all chicken were poultry were exterminated because there's no food for them. So there's no more chicken. There's eggs. There's no eggs. It's very expensive if you find an egg. So most children who were should be eating eggs and stuff like that, probably if they saw an egg somehow on TV, they will not recognize it in Gaza after 6 months of shortage. So that's the situation, the perspective on famine. My reflection is stories, as John has mentioned, stories. I'm going to mention just stories and perspectives. So, sometimes people think that Global only send doctors from the United States and nurses to disaster areas, to Gaza. And that is not the case. Uh, Medical missions is only a very small part of what we do. Most of the work is done by the doctors and the nurses in Gaza that John has spoke about. We run now about 10 medical points, and we employ 110 doctors and nurses and staff members who are local Palestinian doctors and nurses. And they are the ones who are providing daily care to 5,000 patients every day. 5,000 of patients every day receive medications, free consultations by physicians, wound care, mental health support, prenatal care with ultrasound, pediatric care, internal medicine, medications for chronic conditions, and even sometimes referral to more advanced procedures when it is available, although these are becoming now very scarce because of the work of our doctors and nurses who are local doctors and nurses serving their communities and themselves are displaced. So it is very important for donors to understand that when they support MediGlobal, they don't just support the 5,000 patients who are receiving free care, but they are also supporting the 110 doctors and nurses and their families, extended families who are themselves displaced and who don't have access to income at all, and who are also themselves targeted because they are not deconflicted. These areas are not deconflicted, so a bomb can hit anytime. And every patient, every doctor I've seen had painful stories, and had, one of the doctors, Dr. Abdul Latif, whom I met with our first medical mission, and I think you remember him, Dr. John. He lost 99 members of his extended families. 99 members. One time he had 55 people staying in his house, all of extended family members, and a bomb hit and all of them were killed. He was in the hospital. So we're talking about extreme massacres that happen to individuals that we cannot imagine or even fathom. And despite of that, you see these people going on and continuing to work and serving their communities. One of the humanitarians I met in one of the distribution centers. This is a distribution centers of food and supplies run by Catholics relief services. So the head of the warehouse, his name is Bassam, very intelligent person. He told me that we need 1,000 trucks every day, not the 100 and 200, because before the crisis we had 500, but right now it's catastrophic. So we need 1,000 trucks. His deputy told me a story that one of his worst experiences that he had to tell the family of his brother that his brother is killed, is dead. So his brother is young. I think he was 30 something years old. He was in area in Khan Yunis that was under attack, and he was afraid of leaving that area because he did not want to be killed. And his family were evacuated earlier, his wife and 4 children. So he was waiting until the situation gets safer so he can go and join with his family. And then when he decided to leave, um, he was shot, and he died on the spot. He bled to death. There were no ambulances in that area, and they could not retrieve even his body. So he was buried on the spot. And there are many people like that, by the way, killed and buried in the spot because they will not be able to retrieve them and do the funerals properly. So their family know that they were killed somewhere and they were buried somewhere, but they cannot even visit their tombs. Um, so he said that this is the worst experience because the family were expecting good news, and he came and told them that that their father was killed. So and too many heartbreaking stories like this. When we talk, and I think people thought that we are heroes because we went to Gaza. I mean, I knew that after 2 weeks that I'm gonna come back to Chicago. Yes, I mean, we saw bombs and stuff like that, but we lived in a house that, as John has mentioned, was deconflicted, and the pathway to the hospital was deconflicted, and the hospital itself was deconflicted. Yes, it was a little bit risky, and we could have been shot like the humanitarians of the war central kitchen, or a missile hit us or something like that, and we experienced missiles and bombs and sounds, and the house was shaking. But it wasn't like the Palestinian doctors and nurses who know that they cannot leave and they are stuck, and many of them left had huge losses. They lost their houses, their practices, their hospitals, their neighborhoods, their universities, their income, and family members, and some of them are injured, and they are now ended up in a tent where they have to spend 5 or 6 hours to bring clean water and bread, only bread and canned food, to their families, and they keep working. These are the heroes, not us. And I think when you are supporting MediGlobal, you're not supporting us. I want to make sure that this is clear. We are volunteers who are going there for 1 or 2 weeks and then come back and tell you the stories. So we are storytellers. The real heroes are the people who are in Gaza, in Rafah, who continue to work despite of the circumstances, who don't have even time to breathe or think of the future. Um, one story is, I repeated it many times, and I think I'm gonna repeat it one more time. I have this habit of asking children, "What would you like to be in the future?" And this, give you an insight about how the community work, the expectation of the community, and also it can give you some hope sometimes, because children do not lie, and when they tell you, and every child I ask in Gaza, what would you like to be in the future? They tell me a doctor, not martyr, a doctor. So people sometimes think that people want to go and die and stuff like that, but people want to serve their communities. They want to serve their communities, and medicine and healthcare is something that is children look at very high in Gaza. Gaza has one of the most developed healthcare system before this crisis in the region. I've been going there for 4 years. John has been there in 2019. We have doctors who've been there for 4 years, and we know Nasser Hospital before the war. We know Al Shifa Hospital before the war. These are amazing centers. By the way, even 5 centuries earlier, Gaza had one of the oldest and highest quality healthcare system even in history, the Bimaristan of Gaza. So it goes deep in history that Gaza has good healthcare. In the Middle Ages, when Europe did not have even any hospital, Gaza had hospital. Al Shifa Hospital was established 1946, 77 years old. It's amazing institution that has 5 buildings, one of them for surgery, one of them for OB/GYN birth center, one of them for outpatient. It provides healthcare to 500,000 patients every year. 500,000 patients every year, inpatient and outpatient. The emergency room receives 250,000 patients every year. They perform 25,000 advanced surgery every year. They perform 70,000 dialysis session every year. All of this is gone. So Al Shifa Hospital provide 20%, 25% of the healthcare system capacity. And you remove that and you expect people to continue to have treatment. Many people who were receiving treatment in Al Shifa Hospital will die. They will not have the sophisticated surgery that were only done at Al Shifa Hospital. This is the only tertiary center in the north, which is the most developed compared to the south. Nasser Hospital is the equivalent to Al Shifa Hospital. It's taken out. So when you remove tertiary centers like Al Shifa and Nasser, you're not only removing maybe a hospital or two hospitals, you are removing actually the heart and the core of the healthcare system. That means the remaining hospitals will not be able to accommodate these patients who used to have treatment, dialysis, surgeries, inpatient treatment, patients with chronic diseases, advanced chronic diseases, who had access to the best specialists in Al Shifa and Nasser, and they don't have beds right now. Gaza had 5,000 hospital beds before the war. Now they have 250 beds after the 6 months of war. So this devastation, this systematic destruction of the healthcare system is affecting everyone in Gaza. And I think that's why it's important to support programs run by local doctors and nurses and midwives in organizations like MidGlobal. We do not parachute in and parachute out. We don't just send people who can do some surgeries and procedure and come out. We stay with the population for the long term. I think it's important to mention a couple of things. That we've been in Gaza since 2019. Other organizations have been in Gaza. We are registered in Gaza. We have bank account in Gaza. People ask, how can you transfer money to Gaza? We transfer money through banks, from bank to bank, because we are registered. We do things officially. People ask, are there still bank open in Gaza? Yes, there are still bank open in south of Gaza, in Rafah. So we transfer money there to our staff, and they can give the doctors and the nurses salaries and procure equipment and supplies that are needed. And also we send trucks of medical aid from Egypt and from Jordan. And we have team in Egypt, and we have also memo of understanding with the Jordanian Hashemite organization that is responsible for the aid to Gaza from Jordan. So we're doing things right. We also send with our volunteers who are able to go every month medical supplies and sometimes thermals. When I went to Gaza, I took with me 5 or 6 bags full of medical supplies, medical equipments, and thermal underwear, because it was very cold in Gaza at night. I was very cold in the house in Gaza because, of course, we did not have heat, and I had 3 blankets. And 1.2 million people in Rafah area are displaced. That means they are either live in tents or in classroom of schools. And every classroom has 40 to 50 people. 40 to 50 people, every classroom. So you can imagine the hygiene, you can imagine the crowding, you can imagine the stress on people. One of the classroom, I don't know if you visited, John, of Dar al-Fadila. This is a school that used to be run by UNRWA and converted to a shelter for displaced population. I met this physician, his name is Rashid Al-Qannour, who runs the medical point that made global support in the school. So a small area, smaller than this office actually that I have. And there was the doctor, and they had like 4 nurses, and they were changing the wound of a child. The child was 12 years old, and I asked about his story because he lost his eye, and he had a dressing on his back and dressing on his leg. And they told me that he was collecting wood to warm the class, where his family were staying in one of the classrooms. And then a drone hit the area, killed other children, and shrapnels hit his eye. He lost his eye, and also his back and his thigh. And they were changing his wounds, the dressing on his wounds, without local anesthesia, of course, because there is no local anesthesia. And he was clenching, but he was not screaming. Gaza kids are very brave. So he was trying not to scream, but he was clenching on his jaws. And this physician, Rashid Al-Qannour, one of the most humble physicians I've seen, he was displaced from Jabalia camp in the north with 50 other members of his family. He lives also in the shelter. He smiles all the time. He's crowded with like 10 people around him. And John has seen that scene where you have, there's no privacy, by the way, in the clinics in Gaza, because everyone wants to have share of the doctors. They ask questions. They want to have prescription. They have a complaint, and then he smiles in each one of them. He answers the woman. He answers the man. He gives prescription for that person. He directs that person to other one with a smile, and he works 12 hours a day. So that's the hero that we need to support. In one of the classroom, I met an obstetrician. She's a physician, an obstetrician who had a C-section in the morning and was discharged after 4 hours to that class where 40 other people are with her newborn. Her name is Tahrir, and her kid's name is Mahmoud. I held him in my hand. These people need to be supported. They're really dignified. They're honorable. Imagine yourself displaced in a tent where you have 15 other people in the tent. And we're not talking about proper tents either. Tents with nylon sheets and around. And where you have facility where 200 people are waiting to go to the bathroom. And imagine yourself that you are a woman or a pregnant lady or a disabled person or someone who has an injury and want to go to the bathroom in the middle of the night from that tent. And it's very cold. So these stress that we cannot imagine here ourselves in the United States, even if we have electricity going for 1 minute, I think the whole country will stop. And there is no electricity in Gaza for the past 6 months. There's no communication. There's no clean water. There's no enough facility. And these people are quiet, patient, and dignified. I did not smell bad odors from the patients I've seen in the clinic because they are clean, despite of the hardship, despite of the fact that are living in crowded tents. And they come with a smile. They invite you for a cup of tea, and they are looking for the future. Children want to be doctors because Gaza has one of the highest literacy rates in the world. 97.5% of Gazans, of Palestinians in Gaza are literate because of the work of UNRWA. So children wanted to be doctors, except for one child. I saw him in the same school. His name is Abdullah in Dar al-Fadila. And you can look at his face and you can see, or you say, okay, this is a traumatic child. He was not smiling. He has the flat effect that you can see in patients with PTSD. I asked him, what would you like to be in the future? He said, what future?
Wow.
So I think it's important for us who have, you have children, I have children, I have grandchild, Jean has children and grandchildren, and they have access to the best schools, to the best nutrition, to the best exercise, to music, to art, to future. If they don't go to this college, they can go to this university. They can choose what they want to do. They can travel. They can travel. Children in Gaza cannot travel. They're stuck. This is an open air prison, one exit, one entry. And most of the people in Gaza are not able to leave Gaza. So this is the situation. Medic Global has been trying to help as much as we can. There are other organizations, by the way, that are helping. All of them are doing great job. We work in coordination with many other organizations. We work within a cluster. Cluster means a group of organizations that coordinating healthcare and mental health support and nutrition. So that way we do not duplicate or we don't spend more where people are spending. And this is very important. We work in coordination with the United Nations, with the World Health Organizations. We advocate. So besides the fact that we have clinical programs and clinics and hospitals and send medical supplies and send medical volunteers, we talk to the media so that way the message is going to the public. And I think many people have seen our volunteers talking to CNN and MSNBC and Washington Post and New York Times. Jean wrote several op-eds. Dr. Thair Ahmad also did the same thing, and Dr. Nahreen Ahmad. And by spreading these stories, then you are winning the hearts and minds. And you are also pressuring the government because people will call their senators and representatives telling them, these stories are unacceptable in the 21st century, and our government is responsible for it. We had meetings with the State Department. We had meetings with the USAID, with Samantha Power and her team. We had meetings with members of the Congress, with our senators. Even with the president and the vice presidents, we met with them directly, and we told them these stories that I told you. We showed them the pictures of the children that were killed, the patients, the children that died because of malnutrition. And people are influenced when you advocate on behalf of the victims and the doctors. This is and you are in the field. This is very powerful. It's much more powerful than reports that they are reading from their advisors or filtered news that they are getting from their advisors. So when you talk to face to the senators, to the State Department, to policymakers, National Security Council, to the president, to the vice president, that can influence their decision. And I frankly believe that the recent change in policy, which we heard about yesterday, is related to the fact of that we were quite strong in our advocacy.
Yeah, let me mention something, Zahir, real quick, because you alluded to it, but you didn't go into it a little bit. One of the things that is really important with all of this stress, now, Zahir just mentioned a ton of stress. I've mentioned it earlier. One of the things that stands out to anybody who goes in there is that the civil order is maintained. And it's maintained because of the emergent leadership that comes forward. Zahir mentioned a few of the doctors. I'll give you one example that has really stood out to me, and it has stayed with me. The first day I was in clinic, we had just boxes and boxes and boxes of medication and formula and stuff, and we were opening them up and throwing them away, and people kept picking them in the room with me. My translator, who was a dentist, by the way, who displaced them, was, and as she said to me when I was talking to families about their trauma, she said to me, I was under the rubble twice myself. And then she told me, and it had not mentioned it at all until I was talking to a family about it. But anyway, I kept tearing these boxes up and throwing them the way that I usually do, and people kept picking them up and smoothing them out. At the end of the day, what I found out was these boxes were essentially commodified. They smoothed them out because they became kindling for the fires that kept their tents warm. And it wasn't just that. Every day, different members in the room, they would share the boxes. So it wasn't like who could get them first and put them away. They actually had a system among themselves about how this very important commodity, which in the United States would have just been thrown away at the best into a recycling bin, but at the worst is thrown away, that they actually put it together and shared it. So the ability for folks under this much stress and this much chaos to share is just amazing. It's beginning to be stressed. This is why we need a ceasefire. It's beginning to be stressed, but it really has held remarkably. You agree with that, right, Zahir? You've seen this.
Yeah, I mean, I expected that people would be fighting in the streets.
Yeah.
You remember when we saw the bakery? There was two bakeries that were open, and there were 300 people standing in line on one side, men, and the other side, 300 women, waiting for the bread. If this situation where you have no bread happen in Chicago, I think people will just.
I mean, Taylor Swift tickets they'll fight for. I mean, this is life. But and up the street would be the kids waiting for water, and the lines held. I mean, there was a couple of fools everywhere, but the lines for the most part held perfectly. It was amazing, absolutely amazing.
So you're talking about the community there, and sorry, that's my adhan going off for my breaking of fast, but I wanted to talk about some of the questions that we're getting. First off, if you're watching on Instagram and the Instagram time limit for our live is an hour, we ask you that you keep watching on Facebook or on Twitter or on LinkedIn. We are live on all platforms. So we're going to keep going for another about 20 minutes, 25 minutes. Dr. Zahid and Dr. John, we're getting questions around what is the donation policy? How much of people's donation is going to the aid directly? Could you highlight and answer that question, as well as remind people some of the costs associated with their donation? This is an important night. People want to know what they're donating to is tangible. $35 for formula. What else can we share with people about the donations and where their funds will go?
We are one of the few organizations that spend most of the money that are donated on programs. And first of all, let me tell you that you have to do your homework before donating to any organization. Do your homework, look at the website, look at the reports, look at the financial reports. These are important stuff. We had organizations, I'm not talking about Gaza now, talking about the rest of the world, who spend 50% of their donation money on administration. 50%. That means every dollar you donate, half of the dollar goes for administration. So it's important to make sure, and also, if an organization told you that 100% of your money will go to the programs, that's a lie, because there's always cost incurred in hiring staff, in getting logistics, transportation, all of these things that are needed to get the medicine to the person. And we don't just package medicine and send it to Gaza. We run clinics, we run mobile clinics, we support hospitals, we work with the authorities, we have staff. So there's administration. And so our administration is about administrative fees and fundraising fees, because fundraising also requires spending, is about 4%. That means 96% of your donation goes into the programs to benefit the people who are benefiting. So this is really high percentage that are going into the program. We're a young organization. As we become bigger and older, larger part probably will go more into administration, because you need to oversee the programs. You need to hire more people. You need to make sure that people are not stressed. We are very lean and mean organization. We have 350 staff members in all over the world. But I think we need to hire more people, so that way our staff do not get burned out. But to answer your question, 96% of donations go into programs.
And then
And that's an amazing statistic, by the way.
that's very high. I've been in the NGO world for a very long time, and that's probably the highest program rate I've ever heard, and lowest admin and operations cost. Dr. Zahid, can you remind people what the cost of donating? We have some new folks joining, people who want to volunteer, which I'll get to in a second, on how they can volunteer. I'll repeat myself because I know new people are coming in. But how much of, what is some cost associated with the medical response in Gaza? So we know $150 covers medicine for 5 people. We know $250 can cover medications for 50 people. So what are the specifics around the donations?
So what we are doing right now, I mean, there's all kinds of things that we do in Gaza. So in the first phase of the war, we were procuring, that means buying medical supplies that are needed for the operations of hospitals, gauze, sutures, antiseptics, and so forth, from inside Gaza, because in the first phase of the war, they were still suppliers before the destruction and all of these things. And we spent about $1.5 million in buying medical supplies and distributing them to the 16 hospitals in the north. And that saved tons of lives. And we did this really early, where we purchased the medical supplies and distributed them to make sure that we are, we give these hospitals breathing room, because there were a huge shortage of supplies because nothing were coming in. In the second phase of the war, after the displacement of the population, we started to focus on primary health care, because most of the population needs primary health care, and most of them were deprived from their access to their doctors, to their clinics. There's a lot of talk about hospitals, but not much talk about the clinics. Most of us go to the clinic when they have abdominal pain or headache, or our children have a fever, or if you're a woman who is pregnant and needs prenatal care. So 75% of the clinics also have been closed. 75%. That means about 2 million of the population are deprived from primary health care. So that's why we opened a huge primary health center that John and I worked in. And I expected, actually, when I stepped into that center in an area called Tal Sultan in Rafah, to see maybe 30 patients and waiting for 50 patients. We saw 700 patients in very small hallways waiting for multiple clinics the first day. The next day, we had 800 patients.
And you want the worst job? You want the worst job in the world? All of those patients were registered. So try being the registration clerk for
Wow.
700 patients in a clinic. Yeah.
A day.
A day. And then every medical point is a clinic inside either a camp where you have tents, a big tent for the clinic, or a classroom out of the shelter of the school. So these are called medical points. Each medical point serve between 250 to 450 every day also. So total about 5,000 patients who receive as I mentioned, physician consultation, prenatal care for pregnant women, pediatric care, antibiotics if they have infections, urgent care. The clinic that we have, it has urgent care center, wound care, and medications, free medications for their chronic diseases, and free basic labs, and some X-rays, EKG, echocardiogram. We have all of that in the facility. So these are the services that we do. To run a medical point for 6 months, the cost is about $50,000, and which means the salaries of the physicians and the nurses, the medications, the labs, and everything this associated with it. So if you want to sponsor a medical point, and we would like to open as many as we can, because that's the best and priority at this point. Surgeries are important, of course, and supporting hospitals are important. But in a situation like this, where you have large number of the population who are in need for primary care becomes the first priority, right, John? Because
Oh, absolutely. The other thing is prenatal care.
Mhm.
Because that is one course, unlike hypertension, and that will go from beginning to logical outcome. And I'm not sure. Do you have it costed out, Z? How much it would cost?
Prenatal
Because that's a wonderful way to contribute. And we're trying very hard to think about how to open up a delivery center and things like that, because that's a huge need, huge need.
It's
And
part of every, and this is a good question. It's part of every medical point, and of course, the clinic that we have. So we have trained obstetricians
Yeah.
and midwives who provide prenatal care, who provide medications. They screen for the blood pressure. They do the ultrasound to see the size of the fetus and so forth. And all of this is incorporated in every medical point. So
and
we
that's
are part of a larger campaign, global campaign called
Yeah.
For Mama, to reduce mortality and
Yeah.
morbidity related to pregnancy and deliveries.
And it's well documented now that the prematurity rate has gone up. The cesarean section rate has gone up, and actually, doctors have been doing something that most doctors in the United States haven't even done, which is post-morbid C-sections. Women who have died have
stillbirth.
had to have a C-section because of that. The incidence of that is increasing also.
Yeah. Thank you both so much. Just on that point, I know, Dr. Zahid, you were mentioning For Mama, and I wanted to uplift that because donations made today on this live stream right now that support the maternal health and the prenatal health and all the NICU health that the doctors here have been explaining today are going to be matched and multiplied. So for every $3 you donate to Med Global for these causes, $1 will be added through the Bill and Melinda Gates Foundation until the end of the month. And so next Saturday is the last day of the For Mama campaign. Med Global is one of the partners. This is the first time organizations that are faith-based or faith-inspired have come together under this umbrella to protect and advocate for the lives of mothers and babies and raise funds for them. And the Bill and Melinda Gates Foundation is matching all the funds raised. So Med Global is doing amazing work in this area. And so if you want to give to that cause, please make a note in your donation. Text Gaza to 801-801, and that will be matched and multiplied. So that's really, really important. We have a couple of questions coming in. I want to just remind people again, if you're on Instagram and it cuts off, please go to YouTube, LinkedIn, Facebook. We are still going on all the platforms. We also, for people who want to volunteer, we are always welcoming volunteers from various medical fields to apply to our website, medglobal.org, and submit a volunteer form. There has been an overwhelming response, which me and Dr. John had talked about earlier, but every application is reviewed and you will be reached out to if it is a need that we have for our mission trips. I think what was really important, I want to uplift, is that Dr. Zahid and Dr. John both talked about how we have medical missions, but it's one small part of the work that Med Global is doing. So whether you can come on a medical mission or not, we want to be able to engage you on that. But we also want you to remember that we are employing the actual leadership and local communities on the ground to lead in their own response effort and to build a sustainable change that we want to see. So everyone that we're employing in Gaza are Palestinians in Gaza that are serving the community every single day, whether or not there's a mission happening. But maybe we can talk a little bit about when the next mission is happening and anything else you all want to mention on volunteering and why it's important to get people to get engaged and following us on all platforms, because this is an advocacy effort. We are here to shift hearts and minds, as you mentioned, Dr. Zahid, and raise funds. But this work is going to need to be ongoing, as John said, for generations to come.
Let me jump in on this because I'll be going back at the end of April. and I'll be going back for two reasons. One is that we, at the last trip, we rolled out the beginning of a community center, community-led mental health program, and using the emergent leaders in the community and a large civil society group called Aisha. So we'll be going back to do second level training there. But this other thing is, God willing, we will continue to go up north and set up in Kamal Adwan the secondary, our second nutrition resuscitation program, along with outreach there. Obviously, things change day by day. Hopefully, as Zahir said, after with the advocacy that he and my senior colleagues did at the White House, and this latest change with opening up Eretz and other crossings, it'll actually be improved. But we'll wait to see behavior more than words on that one. So
I
I'll be
want to
going back at the end of April. Yeah.
so I want to speak about two cool things, which reflects the impact of an organization like MedGlobal. But the next medical mission, to answer your question, is in April 12th. So we have a group of doctors coming, actually, most of them from Australia, but we have also a few American physicians joining that group. And then every 4 weeks, we have another mission. So far, we have sent 3 medical missions, and every month we will have a new mission. So there is a cool device called portable ultrasound. This is a probe that you can connect to your iPhone, and your iPhone becomes a Doppler screen. And you can put this probe on the chest of the patient to see if there is any fluid or blood after trauma. So many, of course, people who are injured in the field are brought to the hospital, and they have either shrapnels in their chest or in their heart or in their belly. And you want to decide at the bedside whether this patient will require a procedure, life-saving procedure, like putting a chest tube to drain blood, or they require an open chest surgery if there is blood around the heart, or if they require abdominal surgery if there's blood inside the belly. So this ultrasound that you do with the probe, it can let you within 2 minutes, 3 minutes, examine the chest, the heart, the belly, and decide this patient will require this procedure or that procedure. It requires some training. So MedGlobal was the first organization that introduced portable ultrasound to Gaza in 2019, when we had the first medical mission to Gaza. We trained doctors in Al Shifa Hospital and doctors in Nasser Hospital. Then every few months, we used to send another team. Dr. Thayer Ahmed went there twice, and other physicians, and they trained other physicians who trained other physicians. So that's called training of trainers. So you train a physician who will train others. And we donated also a lot of these portable ultrasound. Each ultrasound device cost about $3,000. So if someone wants to sponsor an ultrasound, life-saving ultrasound for thousands of patients, then you can donate $3,000. This time, when we went to Gaza during the war, every emergency room physician, every ICU physician I've seen in Nasser Hospital is using ultrasound, portable ultrasound, and they are managing their patients.
Wow.
So that will give you an idea about the impact. We talk sometimes about the impact by numbers, like we are treating 5,000 patients every day. But this impact is even more important. And we cannot measure it just by saying, oh, we trained 10 doctors or 20 doctors, because these doctors trained others who trained others, and all of them are saving patients because of this device. Kamal Adwan Hospital that John has mentioned. In 2020, MediGlobal supported their ICU, pediatrics ICU. So they did not have pediatrics ICU in the north at that time. So children were brought to Al Shifa Hospital. It's 2-hour drives from Beit Lahia in the north. So we supported with Rahma opening an ICU for the children in Kamal Adwan Hospital, furnishing it, having ventilators, monitors, incubators, and so forth. And it started operating. Before this war, we were supposed to open a multi-specialty clinic for adults also in Kamal Adwan Hospital. We also supported them with medical supplies, with salaries for their staff before the war. And now Kamal Adwan Hospital, because of the work of Dr. Hussam Abu Safia, who refused to be evacuated to the south, even though that his child, his son was injured with a sniper, his house was destroyed. He has the option actually to leave Gaza because he has citizenship from Kazakhstan. His wife is from Kazakhstan, but he refused. He stayed there. He reopened the hospital. He added more departments in the last 2 months, and now Kamal Adwan Hospital is the only fully functioning hospital in the north, serving the maybe 300, 400,000 population in the north. So that
And
also can give you an idea about the impact.
when I was there in March, they had actually expanded because of the need. They had actually expanded the pediatric intensive care unit, and they were now had adults that they were seeing in there because of the need. And the other sad thing about it was we supported the NICU, and when I was there, Dr. Hassan showed me all the monitors in the the neonatal intensive care unit had been shot by the IDF when they came in. So they all had bullets, and the monitors were all out because of bullet wounds.
And just as a reminder of the importance of the impact of our services and the equipment MedGlobal is doing. I love that story, Dr. Zahid. I love that you came back and saw everyone using the POCUS ultrasounds. I mean, that is truly the sort of life-changing, generational change you want to see. We have only 5 more minutes into this, and we want to play Dr. Thad's video one more time for the audience, since we have a bigger audience now watching us. We want to thank everyone who came and joined. I want to thank you, Dr. John, Dr. Zahid, for not just your words and powerful, but to remind everybody the human cost of this all and the human impact. And it is so important that part of our role as Med Global is to go to these countries and in these spaces and bring back these stories and advocate, amplify their voices. They are not voiceless people. They are not people who don't have agency and dignity, as you mentioned, Dr. John, but they are people who need to be amplified. And we are there to do that for them as Med Global, and in solidarity with everyone else that's been working so hard on the Gaza crisis for 6 months and longer before that. I want to see if there's any final words from you both, other than to please donate. Tonight is the 27th night. We want to remind people that this is a great opportunity to give and give generously. Everything you give, 96% will go to the programs directly, and that's investing in these communities locally in Gaza, in staff, in materials, in equipment, in medicine, in procedures. And there's a lot more to come from nutrition, from, as you were saying, on the prenatal piece, on the primary care. There's just so much work that you all are doing, and it spans across a variety of issues and helping so many people. So any final thoughts before we play?
Yeah, I would like to say that I would like to thank the Ummah, who has received me and wonderfully taking me in over the past 6, 7 years that I've worked. We had the blessing to work with Zahir. He's been a mentor to me, and just a wonderful man, and the community has been wonderful. And I hope you all who celebrate have a wonderful last few days of Ramadan, and may all blessings be upon you. Thank you so much.
Thanks, Dr. John. We're grateful for you, and you are welcome into our family and our community always. Dr. Zahid, final words?
Yeah, well, thanking John, without his effort and leadership, we would not have Med Global. I still remember the first mission that we went together to Yemen, and the airport. And without his wife, I would not be able to go to Yemen. She picked up my passport that I forgot at home on that trip. But also, thanking our board members. We have a quite amazing board, quite diverse. You, Isra, of course, one of our board members, and also our staff, who are the ones who are implementing our programs, overseeing them, making sure that we do things right. Our staff in Gaza, especially Raja Muslih and her team, despite of the stress and the challenges, they keep looking looking for the future and expanding our programs. Our senior managers and our donors, our volunteers, of course, and our donors. Yesterday, I was in Dallas, and we collected a good sum of donations that hopefully will help in the post-crisis recovery and the rebuilding, and some of it will go for the emergency response that we're doing right now. But we've been in Flint, we've been in DC, we've been in Detroit, we've been in other cities, and people were very generous. Chicago, of course, with Med Global, with our programs. These are life-saving programs. It's zakat eligible. If you want to pay your zakat, this is the right expense of the zakat. It goes into life-saving. We also have nutritional programs. So if you want to direct your fund for nutrition for the people who are dying of hunger or children who have malnutrition, then we have complementary program to healthcare. And we hope you the best, and we wish you the best, and we pray for everyone's healing and health and peace of mind.
Thank you, Dr. Zahen. Thank you, Dr. John. Thank you to everyone who tuned in. We're going to end with a video from Dr. Thair Ahmed, one of the Med Global board members and a volunteer. And thank you all so much.
Assalamu alaikum, everybody. Alhamdulillah wa salatu wa salamu ala rasulillah. Thank you for joining us this evening. I wanted to just share a few thoughts with everybody, given the scale of humanitarian crisis that's taking place in Gaza, and how we may be able to contribute in our own ways, and how we can hopefully be a part of the solution. There's a couple of things that I think I'd want to start with. We understand that in the north, the situation is dire, and that people are struggling with food insecurity, malnutrition, famine. This has resulted in the tragic loss of 23 children starving to death. And so the question remains, how do you address this massive problem? What do you do? It's important for everybody to understand you're not going to just be able to feed children right away who are starving. We've let it get to a point that they need medical supervision. They need to be admitted to a hospital, to a clinic, where they can slowly build the strength back up to be able to have food again. Now that's something that Med Global is doing. They're thinking about establishing and seeing patients for a nutritional stabilization center in the north, in the area that is affected the most by this. And they're replicating what they've done in the south. There is already a nutritional stabilization center that is seeing children every single day, that is helping prevent the sort of tragedy that we've seen in the north. And so this Ramadan, I would ask that all of you in these closing days, there's only a few blessed days left, think about how you can contribute to that. Make the intention right now, as you're watching this, make the intention that you want to contribute to alleviate the suffering. And maybe it's by donating to the Nutritional Stabilization Center, or maybe it's other programs. There is maternal health programs that you can easily contribute to that will make an impact. And also sharing this information with other people, letting them know that when it comes to malnutrition and it comes to starvation, it's a lot deeper than just airdropping food. It's more complicated than that, and it's going to require all of us trying to contribute together and figuring out a solution for this. I think that there are a lot of things going wrong in Gaza right now, but let's be one of the things that's going right. Let's try to be a part of efforts that can not only ease the suffering, but bring awareness and attention to this. So let people know that these are the facts that are on the ground. This is what the north is facing. Here's the problem in the south. We know that Al-Nasser Hospital and Shifa Hospital are out of commission. Those are the two largest hospitals in the Gaza Strip, no longer functioning. So Med Global tries to make up for that gap by creating medical points. And these medical points are actually within the displacement camps. You hire Palestinian doctors and nurses to treat patients. Got over 100 of these healthcare workers that are contributing to this, and have over 10 medical points. So all of this is to say that there is a lot of pain, and all of us are feeling what's going on in Gaza. But it's important to be active, to do something about it, to step up when your name is called. And I know that many of us will answer this call. And again, I remind everybody, let's take advantage of these last couple of days. You're in the position that you're in for a reason, and I'm in the position that I'm in for a reason. Let's not forget all of the blessings and the opportunities that we have, and let's take a chance to do some good, to gain some hasanat for all of this, and contribute, and hopefully we make an impact, and we can say that we did something when a lot of people turned away.
Thank you all so much for joining us this evening. Thank you, Dr. Thaed, for your kind words. I know he wanted to be here. Thank you again, Dr. John. Thank you, Dr. Zahid. And to everyone watching, thank you for tuning in to this broadcast. Please remember Med Global. Please give generously. And we hope that everyone who is practicing and experiencing and celebrating Eid and a happy early Eid Mubarak, global family. Thank you, everybody. Have a great night.